Hello everyone. Hello. Good evening. Am I audible?
Yes, sir.
Yes, sir.
Okay. Okay. Just check once. I'll try to write something on the screen and tell me the whether my voice fluctuates or not, because that is one issue I want to address. Okay. I hope you can see my screen. Right. Say for example, I write something on the board. This is my name. Is my voice fluctuating? Is it going down? Or is it okay? Hello? Hello? Can you hear
It is
me?
okay, sir.
It is okay, right?
Yes,
Not
sir.
fluctuating. Okay. Yeah, I actually marked something seeing the yesterday's video that whenever I'm writing something on the screen, my voice is fluctuating. So I guess that thing is okay now.
Yes, sir.
That okay. Okay. Fine. Okay. So it's almost time. So let's start then. It's almost 6 minutes past 5. So I think we have, let me see how many people are there. We have 26 people in the room. So that is more than enough. So we can start. I think people will keep on joining by that time. So this is it. Well, are you practicing, dear? Like, are you practicing your typing and all? Okay. So yesterday, I told you about Rata type. Do you remember? Rata type. There are multiple such sites. Okay. There are multiple such sites. I can show you another two. Okay. Say, for example, say, for example, it is typing.com. There is another site called typing.com. I'll just here. I'll just share this as well. Share screen. Share. Now see, if you can see my screen, this is typing.com. And here also you can like practice typing and see your typing speed, and you can also learn typing. Okay. Say for example, say if you click on students, you have typing lesson, typing test, something like that. So if you click on typing tests, here you will find that there are different timelines. There is 1 minute typing test, there is 3 minute typing test, there is 5 minute typing test. Okay, try for the 3 minute typing test, and automatically if you click on that, it will give you three types of this thing. Like you can type out, this is how say you can type out for 3 minutes and see your speed. So if you press continue, they will give you a text, and automatically you have to type it out. Say for example, value post lay hidden, something like that. So every time you make a mistake, it will actually, you can find. Okay, so this is how it goes. Okay, this is a 3-minute typing speed. You can check you'll also, you can vary the difficulty level. You will have 3 levels of typing: simple one, slightly more difficult, and how that is how it will go. Okay, fine. So I'll just stop share here and carry on with our original presentation. So these are the 2 authentic sites which I personally recommend for typing, practicing typing and developing typing skills. This is actually where I actually I myself practiced and developed my typing skills while I was working as a scribe. So I will recommend these 2 because these are the 2 sites I know personally, and I'm okay with it. I mean, I'm very impressed with their everything. Okay. Now let's get on with our lessons for today. Okay, so I hope you already went through your syllabus and all. Hello, did you go through your syllabus? I hope you already know what your syllabus says. So yesterday, if I recapitulate, if you can recollect, we once again discussed a few things. We once again discussed the 3 major responsibilities of a scribe. Is my voice okay as I am writing? You can hear
Yes,
me?
sir.
Great, great, great. Second, we discussed what is implementation, difference between implementation and transition. I hope you remember that. Okay, implementation and transition. Okay, and how our Scribe basically gets associated or attached to a provider or to a doctor. Okay, so this we discussed. Thirdly, we have started discussing a medical document. We have started discussing a medical document. Okay, and there are some terms or some words which are interchangeably used with a medical document. Okay, those are called clinical document, same thing, clinical document, or soap note, or clinical chart, or clinical note. These all are same things. Okay, these all are same things. Okay, so depending upon provider to provider, depending upon your organization, they will interchangeably use this term for the same document, same thing. I hope it is clear. Okay, so now we have started discussing about the parts of a medical document. Just give me one sec. We have started discussing the parts of a medical document. So, like yesterday, we told that a medical document has 4 parts, or you can say 4 sections. 4 sections. Okay. Section number 1 is subjective. Subjective. Now, what is subjective? Like I told you yesterday, whatever the subject comes and tells the provider comes under subjective. Whatever the subject comes and tells the provider, that comes under subjective. Now, there is basically this is divided into 2 parts. The first one is CC. If you remember, CC stands for cheap complaints. Great, great, great. CC stands for cheap complaints. And the second one is called HPI. HPI stands for history of present illness. Okay, correct. I gave you an example. Say, for example, a patient comes and tells the provider that, see, I am suffering from sore throat and fever for the past 2 days, and this is my main complaint. Though as the then that will come under CC. Exactly what the patient is coming to the clinic for. So we'll write like this, that a patient which, I'm sorry, I'm just getting a call. Just give me 1 second. I'll just mute myself 1 second. I'm so sorry for the interruption because there has been a medical emergency in my family, so my wife is there. Don't worry, okay, just forgive my interruption, okay? No problem. The thing is that the under subjective, we have basically two parts. One is the CC, that is called the chief complaint. The complaint, the basic principal complaint for which the provider is seeing the patient or the patient is coming to see the provider, that is the chief complaint. And on HPI, basically the patient describes the chief complaint. Say for example, the patient says that I was okay till that this day, and all of a sudden I am feeling a bit of sore throat. And as the day progressed, I started feeling feverish. Now, when I measured, I had some 103 fever, and now I am also facing some breathing difficulty since morning. So this will come under all the HPI. From HPI is divided into number of sections. First, the patient will describe the present symptoms. Okay, what the patient is suffering from. Now the patient will describe the past illness. Past illness means whether this patient has any kind of history of this, any kind of history of that. Maybe the patient is a chronic diabetic patient, or a patient of chronic hypothyroidism. The patient is obese. So all your right will be coming under past medical history. Then there will be past surgical history. Maybe the patient underwent some kind of surgery in the past. Maybe it is appendectomy, maybe it is cholecystectomy. Whatever surgical history we have to write that. We have to document that. Okay. You just see one thing. This patient is basically a new patient. This is basically a new patient. So the new patient will tell a n number of things, and we have to record n number of things for the first time. So once these things gets documented, when the next time when the patient comes, we won't be having so much of trouble. Okay, you won't be having so much of trouble while we see the patient for the next time. Okay, so for the first time we will be having like the patient will say too much of data, the patient will say too much of history, the patient will say too much of things. But once that things get documented for the first time, next time when the patient comes for follow-up, we don't have to write so much things. Okay, only the first visit, new visits, we have to document a lot. Okay, so I hope you understand this. Okay, so under HPI we will document the present symptoms, we'll document the past history, we'll document the surgical history, we'll also document the social history. What is social history? Social history means, say for example, the patient is a smoker, or the patient does not do any activities. Say the patient goes to the gym, does some exercises, whether the patient feels like doing work, or feels lethargic during the day. So these are all the social history we have to record for the patient. Okay, so basically HPI becomes a very like elaborate kind of thing. Now the provider will ask you to either elaborate this HPI, or yes, lifestyle, that's correct. The provider will ask you whether to elaborate this HPI or give some one-liners. Now it depends entirely on the provider. The provider will set a preferences, will set preferences, will set preferences. Basically, the provider will ask you, see, my HPI, I want my HPI to say this. I want my HPI to say that. I want my HPI to be elaborate. I want my HPI to be very short, very simple, very to the point. Okay, maybe one-liners. So that entirely depends on the preference of the provider, of how the provider wants his HPI to be, how the provider wants his charts to look like. Okay, you cannot do much about it. You have to stick to the provider preferences. Whatever the provider will ask you, you have to document the HPI just like that. Now here is an important point. Please remember this very, very carefully. Okay, please listen to this carefully, and please remember this carefully. I'll just remove all the drawings here. Okay, now remember, in this section, the patient may come and say lot of things. The patient may come and say lot of things which can be related, and which may be unrelated. Okay, understand this. The patient will come and say related things to his illness, to his ailment. The patient may come and say unrelated things which is not related to the ailment. Now here you have to be very judgmental. Here you have to be very, very judgmental what to enter and what not to enter. Okay. If the patient is talking about his disease, definitely it is related. If the patient is talking about his disease but some other thing, then that is not related. Now I'll give you an example. I will give you one example. Please try to understand. With a very short example, please try to understand. Okay. A patient comes, say for example, a patient A comes to a cardiologist. Okay. Cardiologist with chest pain. Understood? With chest pain. Now the patient says that along with chest pain, I am also having pain in the jaw. Pain in the jaw. Know what is jaw? Okay. And left shoulder. Now, just type it out on the chat box whether these two things are related or unrelated. I'll repeat the question once more. A patient A comes to a cardiologist and says with chest pain, his main chief complaint is chest pain. His chief complaint is chest pain. Now, while describing his chest pain, he says that I am also having pain in jaw and left shoulder. Now, you tell me as a scribe, do you find these two things related or unrelated? Money is saying unrelated. Chest pain is related. Of course, chest pain is. I told you this is the chief complaint of the patient. Now, along with the chief complaint, the patient is saying that I have pain in the jaw and in the left shoulder. So, just my question is whether these two things, this chest pain and this jaw pain and left shoulder pain, is related and not related. I have only two answers. Navya is telling related. Anyone else? You can type it out. Okay. You can type it out. Rocky is saying related. Related. Well, excellent. It is interesting to know that these two things are related. Okay. Chest pain often radiates to the jaw. Chest pain often radiates to the left shoulder. But if you see in discrete, if you might think that these two are unrelated things. So I will document this. I will not document this one. But that will be a big mistake. That will be a big mistake. The provider will say, why didn't you record this one? Because the patient was also telling about jaw pain and left shoulder pain. Because chest pain often radiates to jaw pain and left shoulder pain, and both are related to heart. So these are the things you should know. Which one to capture, which one to neglect, or which one to ignore. So as a beginner, I will request to you with folded hands, please don't leave anything. Please don't leave anything because you are not the doctor. I cannot make you doctor within 1 month. Okay. You don't know which is related, which is unrelated. It's better to capture everything. It's always safe to capture everything. Okay. Now let the doctor decide which is related and unrelated. But please, for God's sake, you don't decide. You write as the patient says. Say, for example, the patient says that for the past 1 or 2 months, I'm noticing chest pain. Okay. And the patient also says that again, I'm also noticing that after the chest pain, the chest pain as if radiates to the jaw and left shoulder. So you have to write it like just like that only. Okay. You cannot write. I told you yesterday also, you have to write the HPI in the words of the patient. You cannot use medical terms. You cannot use technical terms. If you do you know the technical or medical term for chest pain? Anyone? What is chest pain? What is the technical term for chest pain? Anyone? It's called angina. Okay. Angina or anginal pain. Okay. So you cannot write the patient is reporting anginal pain. No. It's not allowed. The patient is reporting chest pain, not anginal pain. Okay. You cannot use technical terms in the HPI. You have to use layman terms, even just like the patient is saying. Okay. If the patient comes and says that I am having anginal pain, then that is acceptable. But the patient is saying chest pain, you are writing anginal pain. So absolutely that is not acceptable. Okay. I hope you get my point. Okay. So my request to you, please don't decide which is related, which is unrelated. Let the doctor decide. Let the doctor edit your final charts. For the initial few days, you will get the hold of it. After you work with the doctor, say for 1 month or 1.5 months, automatically you will get to know which is related and which is unrelated. But initially it's very difficult, very difficult to understand which is related and which is unrelated. Okay, so please don't take things or presume things. Avoid presuming. There is nothing called presumption in medical science. You cannot presume. Okay, if this may be related, this may be unrelated. No, you are not supposed to do that. Okay. Okay. Now, there is a specific format which we normally use to describe HPI for the present illness. Okay, present illness symptoms. There is a specific format. I will give it to you. Don't worry. Okay. So basically, we write like this. We start with the site. Then we talk about the onset. How did it begin? This is basically a format. Huh? So try to stick to this format. Whatever sequence the patient says is immaterial. You stick to this format. Say, for example, the patient is facing chest pain or throat pain. So that will be the site. Now, how did it begin? And onset. What will be the character? Character means what is the pain type? Is it a throbbing pain? It is a burning pain? It is a sharp pain? It is a dull pain? What kind of pain? Okay. Site, onset, character. What aggravates the pain? What relieves the pain? Okay. So these are the things we normally use to describe the symptoms. And will be the sequence. No, this will be the sequence. There is another thing called duration. So how much the patient when the pain starts or when the symptoms start, how much it is basically it lasts. Say, for example, there is an onset of chest pain which lasts for 1 minute or 2 minutes. Then we have to talk about frequency. Frequency means 2 times a week, 1 times a month, once a month, 3 times a week, something like that. So you have to describe the symptoms just like this. So try to follow this format. I'll give it to you. Don't worry. Okay. So doesn't matter how the patient says. The patient might say this one first, then the patient might say this one, then the patient might say this one, then the patient might say this one. No, you have to be very subtle. You have to be very decisive about this sequence. You have to just follow the sequence like this, because this becomes very much easier for the provider to know and document things. Say, for example, I'll give an example. The patient comes and reports for chest pain, which lasts for 4 to 5 minutes, and the patient is facing the symptoms for the last 2 weeks at a frequency of 3 to 4 times per week. Okay, he has seen that walking aggravates the symptoms, while taking rests relieves the symptom. So this becomes a very nice and elaborate like HPI, history of present illness. I hope you get the point. I hope you're getting the point. Okay. So this is how we follow the sequence of an HPI. Okay. The sequence of an HPI. First, we talk about the present illness. Then we talk about the past history. Then we talk about the surgical history. Then we talk about the social history. Okay. So this will make the HPI. Okay. If you can follow this format, it is excellent for you. You'll make a very nice scribe. This will make you a very great scribe. Okay. I hope you get it. Okay. Now I'll remove all this. Okay, so this is all about the subjective part. This is all about the subjective part. So our first section is over. Now we'll come to the objective part. Objective part. Okay. Achha. In subjective part, there is one more thing. I'm sorry. The subjective part, apart from CC, HPI, there is one more thing called ROS. Now I'll going to discuss about ROS. Before going into objective, I'll discuss this one first. Okay. Now, what is ROS? ROS stands for review of systems. Okay. Review of systems. So from head to toe, you have to describe everything. There is normally this is template based. Do you know what is a template? Template means there is a predetermined or pre-organized kind of thing. You just need to fill up. So we'll start from head, then we'll go to CVS, then we'll take respiratory, then we'll go to GIT, then we'll go to say skin, then we'll go to musculoskeletal, then we'll go to neurological, and it will end like this. So head you will describe as head is normal, nothing, the patient does not have any CNS. Okay, right. Head and neck, yes, that is called CNS. It is also called CNS. There is also called head and neck. Okay, so there is no symptoms related to head and neck. There is no symptom related to CVS. CVS means oh no, because the patient is coming for chest pain. So definitely there will be symptoms related to CVS. There will be symptoms related to respiratory. GIT, there will be no symptoms. Skin, there will be no symptoms, normal. Musculoskeletal, everything will be normal. Maybe there can be edema. There may be edema, you have to describe it, that the patient has swelling in the feet, fatal swelling or something like that. Again, this has to be described in the patient's own words. Okay, this is subjective. This is subjective. Okay, the patient has, whatever the patient is saying, we have to describe that. And lastly, neurological. So we'll say that there is no neurological symptoms. This is how we normally describe the ROS. ROS means the whatever the system wise, the what the patient is saying system wise. But normally all these things are not discussed during the visits. I'm sorry to say this, but 99% of the times the doctor won't time to have time to discuss all those things in the visits. This is basically template based. You just have to pull the template and attach it, and you have to just copy the template and paste it. That's all. Okay, then automatically it will get auto populated. Anything, any related thing, you have to edit. Say for example, if the patient is coming with chest pain, you have to edit this one, CVS and respiratory. If the say patient is coming with GI problems, you have to edit only this one. If the patient is coming with musculoskeletal problem, you have to edit this one. Most of the other things will remain unchanged. Okay, is it clear? I'll also, if possible, I'll also send a template for ROS, how ROS look like. Okay, we'll get to know what I'm trying to say. Okay, so everything will be there, just like that. All you have to do is just change or edit the related sections. Otherwise, it will mostly remain unchanged. It will mostly remain unchanged. So this will complete the subjective part. So to summarize, we saw that the subjective part has three things. It will start with chief complaints. It will have a HPI section. It will have a ROS section. Okay. This will complete the subjective part. Here, basically, subjective means whatever the subject or the patient is coming to the clinic and telling the doctor about what are the symptoms he is facing. This is all related to the symptoms. Now, see, now what will happen? Now, whatever the doctor has, the doctor has heard from the patient, the doctor is going to verify. Normally, what he will do? I can say n number of things to this, n number of things to you. So you have to verify whether I'm telling the truth or not, whether I'm telling to the truth or not. This will basically, this will basically, this will basically rule out whether it is related or whether there is unrelated. Okay, this will basically, this will help you decide whether that is related or this is unrelated. Okay, so the doctor is going to verify. Now, how will he verify? He will verify objectively. He will verify objectively. Okay. Say, for example, the patient then comes and says that I'm having pain in my right shoulder. So the doctor is going to press the right shoulder and see if there is any pain in or not, if the pain is getting triggered or not. Okay. So that is called objective history. I mean, objective examination. Okay. Or we call this PE, physical exam or physical examination. Okay. Same thing. Physical exam or physical examination. Here, the basically the doctor is going to check all the systems. Again, this will be system wise. It will start with CNS. Okay, then we will go to say CVS, then respiratory. Okay, then they say for example musculoskeletal, then say for example skin. So this is again system wise. The doctor is going to objectively find whatever the patient has told, whether it is correct or not. This is also very template based. Mostly it is template based. Most of the doctor uses templates for this. They do not have that much of time. So they will only they will related things they will only check. For example, the patient comes and says that I have pain in my left shoulder. So automatically the doctor is going to examine the left shoulder and automatically you have to edit this part. Okay. Now, the here in physical examination, you have to use medical terms. You have to use medical terms because here the doctor is saying something about the patient. Okay. Say for example, the patient is saying that I have pain in my left shoulder. Now the doctor presses the left shoulder and finds pain. So the doctor cannot describe that he has pain in left shoulder. He has to describe that left shoulder is tender. Have you heard this term tender or tenderness? Okay, tenderness in left shoulder. Same thing. Okay. Left shoulder tenderness or left shoulder tender left shoulder, whatever you can say. So tenderness means there is some existing pain with the patient, which the doctor has found out. Pain is something that the patient comes and tells the doctor, but tenderness is something which the doctor actually finds out that yes, there is tenderness. So pains becomes subjective because the subject is coming and telling me. Tenderness becomes objective. So these two matches. So the patient was telling the truth that yes, definitely he has some pain in the knee or in the shoulder because there is tenderness. Now the doctor definitely concludes that yes, something is wrong, something is not right with your shoulder or with your knee. It's because I am finding some tenderness here. Okay, the doctor may also find some redness in the shoulder or in the knee. The doctor may also find that the temperature is raised. So these are all objective findings. These are all objective findings. Objective means the doctor is basically finding those with the patients. The patient did not come and say that, see, I have redness. The patient did not come and say, see, my temperature is raised. No, the doctor is finding these things. The doctor may say, the patient may come and say that I'm feeling feverish. Now, doctor examines the patient and yes, sees that yes, the patient has fever. Okay. So in that case, you have to say pyrexia. Okay. Pyrexia means fever. So normally in the physical examination, we have to use medical terminologies. Okay. Medical terminologies. The doctor will use. You don't have to use. The doctor will automatically use these terms. All you have to do is capture. You have to capture these terms and just write it in the this format. Okay, all you have to do is capture the term and write it in the format. The doctor will automatically utter those things. Okay, the doctor will automatically say those things to you. Is it clear? Is it clear? Okay. So this is how we write the physical exam. Okay. Basically, physical exam means the doctor is examining the patient physically and trying to find out what is wrong with the patient. Whatever the patient has told, whether that thing is correct or not, whether that thing is true or not. So basically, the doctor is objectively verifying this. This Philippine doctor is saying, yes, that's a very good question from Rocky, that he is asking, if you're not seeing the video conversation, how can we know the patient is feeling pain? And the doctor is saying to us, yes, mostly when the doctor examines, you have to hear the patient, you have to hear the conversation very, very, very carefully. Okay. You have to say, for example, I'll just say the patient is coming and say that I am feeling some knee pain. Okay. So what will the doctor do? The doctor will ask the patient to lie down. Automatically, you will feel that the patient is lying down and the doctor is examining the patient. Now, whenever you see that the patient is, they will ask, are you feeling any pain here? Are you feeling any pain there? Are you feeling any discomfort here? The patient is going to say, yes, sir. Yes, sir, I'm feeling this pain. I'm feeling this discomfort. I'm feeling this problem. So automatically, you know that the patient is telling the truth, or the doctor is basically finding something. Okay. So one thing is how you know that there is pain or not. Second, the doctor will be kind enough to dictate. The doctor may be kind enough to dictate the physical examination. Okay, he can also dictate. So most of the times he dictates because there can be doubts, because you are not able to see what the doctor is doing most of the times. Just give me a sec. Okay. Because you are not able to see what the doctor is doing. So most of the times the doctor is going to dictate the physical exam for you. Okay. So that will make you things a lot easier for you. So don't worry. There are n number of ways to find out the physical exam. So you need not worry about it. Okay. You just have to capture things correctly and put it in the format. That's all. Okay. If you can do that, then you are doing an excellent job. Okay. So I hope you understand what is it. Okay. Say for example, the doctor is measuring the range of motion of a joint. Okay. So say they will basically tell that, say the knee is bending 140 degrees. the knee is bending 120 degrees. The doctor will dictate this. Okay, don't worry. Okay. Most of the times the doctor will going to dictate the APE, but you have to enter this in the particular format. Say for example, you have the PE format. You pull up the PE template, and there are say for example CNS, then there is CVS, then there is respiratory, then there is musculoskeletal, then there is skin. So you have to enter it in the relevant place. You have to enter it in the relevant area. That's all. Okay, that's all you have to do. Rest everything the doctor is going to dictate. Mostly he will dictate, or else you have to figure out from what you have to just create on this thing. Automatically, if you work with the doctor for a few days, you will get to know. That is why I told you, you will be given 10 days, 10 sessions with the doctor. We'll understand what is happening within these 10 days. This 10 days is very important. This is the learning curve for you. I told you yesterday also, no, that you will be having, there is a implementation period, there is a transition period. This period lasts for mostly minimum, you will get 10 days. You can take more time to know what is what. So that time is allowed by the provider. That is the provider will have to allow that learning curve. The provider cannot expect you from day one or day two, you do all those things. No, they will allow this learning curve that can last from 10 days to almost 15 days, 20 days as you need. Okay. After that, you will have to sit for an audit, and the auditor will tell you that you are good to go, or you have to retake. Okay. So basically audit is kind of an examination which you have to pass. If you are good to go, you will pass. If you don't, you have to retake the exam once more. Okay. So this is how it goes. So don't worry. So you have enough number of days to actually learn the things, learn the way how the provider is doing, and automatically will get the hold of it. Don't worry. Don't worry. Okay. Okay. So I hope that clears the objective part. Now the final two parts, AP. So we have completed S and we have completed O. Now the only two things remains, A and P. A stands for assessment. A stands for assessment. Now here, in the assessment part, the doctor is going to, sorry, just give me a sec. Now here in the assessment part, the doctor is going to discuss about the present problems. Okay. The doctor is going to discuss about the present problems with the this thing. Say for example, that we can take the example of knee pain. So the doctor examines and says that there is an acute osteoarthritis. Okay. There is an acute bout of osteoarthritis. Okay. So this becomes the assessment. This becomes the assessment. So this becomes the assessment. Okay. What the doctor will say, the doctor will say that he or she has an acute bout of osteoarthritis, and this will become the assessment. Okay. Now he will describe a plan for what to do. The doctor will say that, okay, we'll do an X-ray. We'll do an X-ray. Just give me one sec. There I have a message. Assessment is not what no. Diagnosis is something else. Diagnosis is something else. This is basically an assessment. Assessment is, give me one sec. I'm getting a call. Just give me one sec. I'm really sorry about it. Okay, please don't mind. Okay, and now, for example, now the assessment and diagnosis is not absolutely different. Different. So basically, he will not say that he has acute arthritis. He will say a suspected case. You will say a suspected case of acute osteoarthritis. You will not exactly come to a diagnosis. Once the diagnosis is done, then everything is clear. But this is basically an assessment based on the clinical examination he did. Based on the clinical examination, we'll find out what is wrong with the patient. Okay, we can say that he is a suspected case of acute osteoarthritis, even if that patient is not diagnosed before. Okay, the patient may have an active diagnosis, but the patient may not have an active diagnosis. It all depends what the patient has. Okay, so basically, the doctor will say that this may be a case of suspected case of acute osteoarthritis, but we need to investigate further to come to a conclusion or to come to a confirmatory diagnosis. Okay, so the plan will be the doctor will give an X-ray for the knee. Okay, the X-ray, say for example, two views. Two views means AP, anterior posterior, and lateral views. Okay, or simply the doctor will say X-ray two views. Okay, so basically this will be the first plan. Second, the doctor may ask the patient to put some ice compression on the knee. Okay. Third, the doctor may prescribe some painkillers or analgesics. Analgesics, for example, the doctor will prescribe say Brufen 400. Say for example, one tab twice daily. This along with the doctor will also prescribe some antacids like say for example omeprazole or rabeprazole 40. Okay, one tablet before meal twice daily. Okay, this is how basically the plan will be. Okay, plan is for cure or diagnosis. No. Plan will be basically the plan of action. Plan of action, once the say for example that the patient comes and sees the doctor, the patient basically expects to do something about the problem, right? So the doctor will do two things. First he will first he will come to a confirmatory diagnosis. So what is the exact problem with the patient? Okay, so the basically he will give some investigations. He can also give some blood tests. Okay, he can also give some blood tests depending upon, say for example, the doctor asks the ear to do a CBC, complete blood count, blood. Okay, the doctor may ask to do for say example, say HbA1c. Okay, so a complete hemogram. So that will also give you an HbA1c value. So HbA1c basically stands for sugar, if the patient has a diabetic or not. So the doctor will come to a proper diagnosis on based of these investigations and based on this clinical examination. In the meantime, the doctor will try to resolve the problems as much as possible, to the extent possible. So the doctor will ask, please go for ice compression, please take these medicines, and automatically after the once the diagnosis is clear, he might change this treatment plan, or he may stick or continue with this treatment plan depending upon how it goes. Yes, the tablets are basically to treat the symptoms and not the disease. Say for example that once this X-ray is done, on the X-ray it is found that too much of osteoarthritis has happened. So automatically the doctor will change this thing to steroid, or the doctor will do an arthroscopy. The doctor will intervene further. Okay, depending on what the X-ray shows, what this blood report shows, that will automatically that will automatically channelize this treatment plan. Okay, this is basically the treatment plan. Now all this now you understand how this SOAP note basically acts. Okay, so basically in subjective there are three things: the keep complaint, the HPI, and the ROS. On the objective we have only one thing, that is the physical examination. Under the assessment, basically the doctor is discussing about the present problem. So basically, I'll just 1 second clear all my drawings. So under assessment, the doctor is discussing the problems the patient is coming with. So the doctor will say, let's see, I think based on all the clinical findings I have seen, you can be a candidate of acute osteoarthritis or chronic osteoarthritis, but I have to confirm that I have to do this test, I have to do that test, and after seeing the results, I can actually tell you whether what is wrong with you. But till then, have these medicines and come after 2 weeks, take follow up after 2 weeks, then with the reports, so that I can tell you more about your disease and chalk out a plan for you. Yes, assessment is not a suspicion. I mean, not at always that is suspected or not. Say for example, a patient comes with sore throat. Okay, so this can be influenza. There can be multiple things the patient has. This can be sinusitis. I'm sorry, pharyngitis. This can be pharyngitis. This can be laryngitis. The doctor is not sure what is what. So the doctor will do some X-rays or do some investigations and basically find out what is wrong with the patient. The doctor will then come to a diagnosis, not before that. So for the time being, basically, the doctor will say that, see, I think you can have this or you can have that. For the timing, you take this. Till then, we'll come with the investigative reports. Next time we meet, we'll tell you more about your disease, and automatically we'll be changing this treatment plan, or go ahead with the new treatment plan, or we can modify this treatment plan, or we can stick with this treatment plan altogether. So depending upon what you tell me on your next visit, that will be decisive for me to actually change these things or go ahead with the same thing. Okay, I hope it is clear. I hope it is clear. Fine. Okay, so this total 2, 3, 4 things will make up a SOAP note. Okay, subjective, objective, assessment, and plan. In the assessment plan, again, I am saying the doctor will discuss about the present problems. Okay, discuss about the present problems. Now, while discussing the present problems, reference to the earlier or previous problems will also be there. Say, for example, the patient is having knee pain, but the doctor knows the patient is a patient of CKD. CKD means chronic kidney disease. So I cannot use painkillers, can I? So the doctor cannot use painkillers, right? So even if the patient is suffering from knee pain, the doctor will not say, please take ibuprofen 400 from next day with omeprazole once daily until come after 2 weeks. No, because the patient is already suffering from CKD. So the doctor cannot take the risk of giving painkillers to this patient. So that will depend. Okay, the previous diagnosis has a major role play in this decision making. Okay, say the patient is an acute the patient has some GIT disease, I mean gastrointestinal disease. Say for example, the patient is suffering from Crohn's disease. You know what is Crohn's disease? Irritable bowel syndrome, IBS. So the doctor cannot use painkillers. So that will depend on the present conditions of the patient, whether the painkillers is basically allowed or the patient painkillers are a drug of choice for the patient or not. It might so happen the doctor cannot use painkillers for this kind of patients. So under the discussion, the doctor will say everything. Under this discussion or assessment, the doctor will say that, see, you have I think that you are a patient of knee arthritis, but I cannot use painkillers for you because you have a history of CKD, you have a history of irritable bowel syndrome, you have a history of Crohn's disease. I'm so sorry, I cannot use the painkillers. But for a confirmative diagnosis, please do this test. Please come with an X-ray. Please come with a blood test. The next time we meet, we'll discuss more about how to do. So for the timing, what will be the plan? The doctor will say, please go for some ice compression and see a physiotherapist. See a physiotherapist for your knee pain. Okay. Till then, you come back to see me after 2 weeks with all the reports, and I will chalk out a plan for you. Okay. Okay. Is it clear? Is it clear? So these are the two major components of a SOAP note: the assessment and plan. Okay. Under the assessment, basically, the doctor will discuss all about the present problems, and on basis of this present problems, the doctor will chalk out a clinical management plan for the patient. Okay. That will incorporate all the sections of your chart, and this whole chart, after you are done, the doctor will sign it. The doctor will sign it. After he will check, of course, he will review your chart, whether everything is in place, whether everything what you have entered is correct. And after that, if he is satisfied, he is going to sign it. If he is not satisfied, he will make some changes and then sign it. Okay, ultimately the doctor has to sign it. The sign is purely a digital sign. It's not a physical sign. The doctor will sign it in the EHR, and automatically you will end up with the complete note. Okay, so that will be the perfect clinical note for you. Okay, I hope you understood the process. Okay, next day we will be discussing about EHR, EMR, okay, and PHR. Okay, we'll discuss tomorrow about all these things. But for today, I hope you understood the SOAP notes. You understood what a clinical chart looks like. You understood what a medical document looks like. You understood what a clinical document looks like. Those are all the same things. Okay, different names, but ideally there's the same things. So I guess that will be all for today. So you just tell me if you have any questions. I want to take your questions for today. And you let me also know that whether the sound quality was okay today. So we can continue this system, because if the patient comes to a doctor with wounds or skin rashes, in that case, no need to, no, there is always a diagnosis. There is always a diagnosis. Okay, okay, I'll just take some more time of you. Okay, just give me 1 sec. Uh, so somebody is asking me if the patient, if a patient comes with wounds or lacerations. So what about the diagnosis then? There has to be a diagnosis, dear. There has to be a diagnosis. Okay. Sometimes the diagnosis is a ready diagnosis. Other times the diagnosis has to be found out. Okay. If the diagnosis is ready, automatically the coder will put the ICD codes. If the diagnosis is not ready, the coder will wait, because depending upon this ICD code, the doctor will put a claim. I told you about this last time. Do you remember? There has to be a diagnosis, that there has to be a coded diagnosis. Otherwise, the doctor is not going to get paid. Okay. So basis of this diagnosis, there will be a ICD code. Okay. The coder will put an ICD code on depending upon the diagnosis. For example, the last example, say if there is an OA knee. There is an OA knee. Now that is a OA left knee. There is an ICD diagnosis for this. ICD-10 diagnosis for this. Okay, so that diagnosis code has to be put. After putting the diagnosis, the doctor can actually claim that yes, I saw this patient on this and this date. The patient was suffering from this problem, and I did this. So please give me my payment. Otherwise, the insurance company is not going to release the payment if I cannot come to a proper diagnosis. So the diagnosis is very, very important. The doctor cannot cannot bear to overlook this thing. Is it clear? So there is a diagnosis for whatever you go to the doctor. There is a diagnosis. There is some very funny diagnosis also. No, no, you know that if a cow, say, comes and you say, even say for example, a dog comes and bites a patient. Even that there is a diagnosis for that as well. Dog bite, snake bite, everything there is included in the ICD-10. Okay. Tomorrow I can also discuss some funny diagnosis, funny ICD-10 diagnosis. You will be amazed to know. Okay. There's some very funny ICD diagnosis also. Any other questions? Any other interesting questions? Maybe. Hello.
Sir, what
So
is
we
HPI full form, sir?
I beg your pardon. Hello.
Hello, sir.
Yeah, please go ahead.
What is HPI full form? Like
HPI.
CP.
HPI stands for History of Present Illness. History of Present Illness.
Okay, sir.
And there is also a particular format to describe the HPI. I told you those, huh? I'll give you. I
Yes.
have something in writing for you. I'll give you all those things. Okay, so don't worry. So there is a particular format for HPI. I told you, no? Say for example, you have to describe the site, you have to describe the onset, you have to describe the character, you have to describe the frequency, you have to describe the duration, you have to describe what relieves it, you have to describe what aggravates it. So you have to describe a lot of things for the HPI. And after you have described those, you have to describe the past history. Say for example, in the past the patient had a similar episode. This is the second or third episode, whatever. That in the past the patient is a chronic has a chronic history of diabetes. The patient has a chronic history of hypothyroidism. The patient has some other metabolic disorders. Acha, if a patient come to the doctor with no problem, but the intention to claim the insurance, in that case, can we identify intention? Yes, of course. See, the doctors are not fools. I don't, please don't understand those that they are fools sitting over there. They are very top class intelligent patients, students. I mean, students become doctors, you know. So they will basically verify. I told you, no. So you can say n number of things to a doctor. You can say n number of things to a doctor, but automatically the doctor is going to verify things. The doctor is going to verify clinically, and the doctor is going to write some tests for you. Until unless he's satisfied that whatever you told the doctor is true to the sense, the doctor will keep on investigating. So until and unless but actually, if the patient has such kind of intention, it is of no use. See, for example, in India, you can claim things, but directly in US, say for example, if I'm a patient, my name is Rudra, I go to a doctor, say X, and Doctor X, say for example, I have an intention to draw out money from the insurance. The problem is that I will be not to be able to get the money from the insurance directly. The insurance will pay the doctor, but not me. Okay, money, right? So there is a chance to lie doctor also. Yes, there happens. Yes, say for example, the doctor is paid on basis of CPT codes, not on ICD codes. The ICD codes is the diagnosis. The doctor is paid on the procedure code. CPT is the procedure code. Say for example, for a simple visit of has a definite procedure code, the doctor will enter those procedure code, and on basis of that he will get treatment. Sometimes what happens is uh, the doctor might give some unwarranted CPD codes. Unwarranted means, say for example, the patient has coming with simple knee pain, and the doctor performs arthroscopy. Okay, but arthroscopy was not mandated or not according as per guidelines. Okay, so in that case, the insurance company can also reject the claim. The insurance company has the right to actually reject the claim. So these things are very common there, but normally there is stringent laws and governing guidelines to actually see whether whatever you are saying, whether it is correct or not. Okay, so please mind that, like, yes, there is possibility for that. So there are other ways to actually verify, understand, like ascertain whether the CPT codes are correct or the ICD codes are correct. Now see, I'll just give you one example. I'll just go to the board once. I'll give you one more example. See, see, for example, say for example, the we'll take the knee pain only. We'll take the knee pain only. Okay. So there is a particular diagnosis for a knee pain. Say for example, it is definitely a OA knee, OA left knee. Say for example, left knee. Okay. So there is a particular ICD-10 code for this. Okay. Now under this ICD-10 code, there will be a certain guideline. See, depending upon that, there will be a particular CPD code for this. Okay. If I say choose another CPT code which does not match with this guideline, okay, then that my claim will be rejected. So I cannot put any procedure codes or for payment. So I know this payment, this for this CPT codes, my payment is $10. For this PPT code, the payment is $15. For this PPT code, my payment is say $25. But for this PPT code, my payment is $110. So what I do, I select this CPT code, but this CPT code this ICD-10 code does not warrant this CPT code. So automatically $110 will get rejected. I cannot put any such CPD code for there. Yes, we are going to get recording class. Okay, don't worry. You will get the recording classes. Please don't worry. Okay. All the classes are getting recorded, so be rest assured we will be getting the recorded classes. Okay. So this is how basically. Can you mute? Hello, whoever it is. Hello. There is too much of background. Can you mute, please? Okay. So basically, there the CPT code has to be accurate and based on this ICD-10 code. It cannot be anything. Okay. So even if I try to extort money from the insurance by putting a overvalued CPT code, I cannot do, because my ICD-10 does not support this CPT. Okay. So you have to be very particular. So I cannot put any procedure codes for particular ICD. So the insurance company is going to catch. The insurance company is going to catch us. And definitely, if it might blacklist the clinic, it can blacklist the doctor, it can do a number of options are there. There can be legal consequences. The doctor won't take such a risk in US. These are all possible in India, but their laws are very stringent on this on these things. So you cannot take that risk. Okay. So any other questions, dear? Any other questions? Yes, yes. There is I told you the process also, that the doctor can reappeal. Yes, the doctor can reappeal. Those Rocky is asking if CPT codes are not matching with actual ICD code 10. Then in case of rejection, they can recreate the codes again. Yes, there is a thing that you can recreate the codes, and you can there is a process of reclaiming or denial management. Okay, so example, if insurance company denies my claim, so there is a process of I mean, you can reclaim your claim, and you can actually go through a process. Okay, there is a definite process around it. Okay. I hope. Yes, of course, it is time consuming. I told you, no. I told you, the whole process is very, very time consuming. There are some 10 to 12 steps in between. You have only managed to surpass the transcription tests steps and convert it to scribing. No, just to save time and just to spend save efforts. Previously, I told you, no, that the process actually, there was a transcription encounter in between, which used to take another 3 to 4 days. Okay, but that step was actually bypassed, and the scribing became popular. It doesn't going to hamper treatment. It is going to hamper the payment of the doctor. It's not that the treatment is getting delayed. The treatment is always prompt, but the payment is getting delayed. Okay, the payment for the doctor is getting delayed. Other than that, there is no other delay. Understood? Hello? It's not that the patient treatment is getting delayed. The patient treatment is take its own course. Okay, but the payment of the doctor is getting delayed. Other than that, everything is okay. But the doctor also knows ultimately there will be this and that, and he will get paid eventually, but it will take time. If you go through the process smoothly, then definitely there is less time. But if you take a very wrong path, if you take a very cumbersome path, automatically payment will get delayed. Otherwise, everything is okay. So that will not hamper treatment in any way. Treatment is not compromised. Clear?
Hello.
Hello.
Sir, I am Rakesh speaking.
Yeah.
So without payment also they can continue the treatment?
Yes. Most of the doctors are salaried based, no. So that doesn't matter. Mostly the practice or the clinical office is the one who is actually suffering, not the doctor. Okay.
Sir, in case if patient is not receiving any insurance claim, so hospital also spend lot of rupees in that patients to treat the disease. In that case,
Yeah, of course. See, that doesn't matter. If the patient has insurance, it's between the insurance company and the clinic. The patient is nowhere in the picture. The patient is supposed to receive treatment no matter what. The patient is supposed to receive treatment no matter what. It doesn't affect the patient per se. It will only affect two things, the provider and the payer. I will discuss all these things again. I told you there are 3 P's. In this whole method, there are 3 P's. The first P stands for patient, the second P stands for provider, and the third P stands for the payer. So I beg your pardon, I think there is a lot of background noise. Hello. So there are 3 P's. So P stands P for patient, P for provider, and P for payer. Payer means insurance, provider means doctor, and patient means patient. So the first P, the patient, once he has the insurance, it is not between him and the provider or her and the provider. No, it becomes between the payer and the provider. Okay. So they will have an understanding whether you are doing things correctly, whether the patient is telling the wrong things or the patient is lying, whatever it happen, it will not affect the patient. Okay, it will only affect the practice, it will may affect the provider to some extent, and it will affect the insurance company. Okay, the patient has nowhere to, like, the patient is not in the picture altogether. Okay, understood?
Yes, sir, it's clear.
Any other questions, dear? And please start practicing on your typings. I want to see how are you progressing. If you can send me screenshots or pictures, like what is the word per minute, what is your accuracy, this means a lot to me. Okay, so I will assign you a target. Please go, if you're starting, say for example, if your typing speed is 25-30 right now, attempt for 40 at least, get to 40. Okay, that will be your target, and your accuracy should be above 90%. So if you are typing say 100 words, you can make 10 mistakes, but not more than 10 mistakes. The lesser number of mistakes you make, the lesser number of reviewing you have to do later. Say for example, if you're charting, if you are documenting something and you make say 3 to 4 mistakes, you have to again correct it. So that will require time, and that will actually that will drain your energy, that will drain your efforts, that will drain your time. So please be conserve these 3 things. These 3 things are asset: your energy, your time, and your efforts. Okay, so please don't waste them. Okay, so absolutely you have to do it real time with the provider. The time is short, so you have to be as accurate as possible, and you have to be as determined as possible. You cannot change. Say for example, you construct a sentence, again you are wiping it off and again constructing a new sentence. That doesn't work here. Okay, so whatever you hear, I told you the sequence, try to follow that sequence, and automatically you will see that things are falling into places. Okay, only in case of new patients, only in case of new patients, you have to put a bit of more efforts. If the patient is a follow-up patient, if the patient is an old patient, you do not have to type much. Okay, only thing is the previous typing is already there, the previous charts are already there. You have to just put in the relevant things. Say for example, the last time the patient was telling about chest pain, but now his chest pain is okay, he's coming and saying something else. He's having some say for example, he's having some swelling in the knee, or he's having some swelling in his shoulder, or in his feet. Okay, so that is not related with his chest pain, so we are not supposed to discuss anything about the chest pain. Just uh, document the things that are discussed, in the visit, not all the things. Okay, you have to be very you cannot be selective initially, but later you will become much more selective, that these things are related, these things are unrelated. Say for example, the patient comes and talks about World Cup finals, cricket World Cup finals, so you're not going to document that, this is unrelated. But related things are out there, can be a number of things which are related and which are not related. So if for example, the patient comes with heart issues to a doctor and says he's having some stomach problems, so that is a kind of unrelated. You may or may not document it, but initially I will request you to document all the things, because you do not know what is related, what is unrelated, and you might miss or end up missing some important related things which was important, but you thought it was unrelated. So okay, it's better not to go into that much of risk. But gradually, if you start working with the provider 1 month, 2 months, 3 months down the line, you will find out, yes, these things are related, these things are unrelated. I can say, because I have worked with provider for so long time, almost 5 years. Each provider has spent almost 6 months, 7 months, 10 months with one provider. So I know his likes, I know his dislikes, what are the things he's looking in objectively looking in the notes. Okay, I know what he's basically fond of. Okay, so that is, we will try to figure out the preferences, and gradually we'll be actually meeting those expectations of the provider. Okay, so this is what this is very simple as that. That is not much. Only thing is you have to have good listening skills and good typing skills. All that is required is these two things. You may not have too much knowledge also. I am not expecting you to have lot more big, big grasp over anatomical things, physiological things. I'm not expecting you at all. I only want some good typing skills and good listening skills. Automatically, there is Google Baba. Okay, if anything you are unsure of, you can straight away ask Google Baba. So you can try, say for example, the patient utters, the doctor utters antibiotic name azithromycin, but in your life you have never heard the term azithromycin. There's so many terms there, so many drugs there. So you have to somehow write it in the Google and you have to search it. So yes, that azithromycin is an antibiotic. The patient is coming with throat pain or whatever infection is. The doctor is suspecting some infection. For that, the doctor is prescribing azithromycin. So that makes sense. So automatically you have to document these things. Okay, understood. So I have 3 more chats. You should know a few. Yes, of course you have to know medical terms. Of course, I never said that without knowing medical terms it will work. No, it's not. You have to know medical terms. Main objective of a medical scribe. Yes, the main objective of a medical scribe is to make the life of a provider easier. Okay, that is our whole objective, to make the life of a provider easier. Okay, that is our whole objective. The provider is mainly disturbed with so many things. So we are there to help the provider so that his life becomes easier. Okay, he can only focus on the patient treatment and leave everything else to us. Okay, clear? Any other questions? Are you able to understand what I'm saying? Are you enjoying the lectures? Are you like, is my teaching style okay with you? You are finding it interesting? Okay, thanks for the feedback. Is it, am I making things easier for you to understand? If I'm making things easier for you to understand, if you like, are you finding it difficult or are you finding it okay? Yes, I will conduct a session on ICD and CPD codes. Don't worry. That is a very late thing. And ICD and CPD codes, I'm telling you, that is not our fort actually. As a scribe, even if we don't know anything about ICD and CPD codes, we are still okay. But yes, I will conduct a session on ICD and CPD codes. Okay, because coding, particularly coding, there is some other professional who will be hired to do only coding. Okay, there are trained professionals to do that. Okay, so do not worry about it. But I will still teach you. I will still teach you coding. Okay, don't worry. Okay, at least CPT codes and ICD codes, I will give you a brief idea. Slides, I do not have any predetermined slides as of now. The recording you will get. Okay, I will get the recordings. I think that will help you. Okay, but I will definitely give you some study materials to go through. I'm sorry. I'll definitely give you some study materials so that you can go through these things. How to describe this say for example symptoms. There'll be study materials to go through. Okay, so don't worry. Okay, dear. I think that will be enough for today. Tomorrow, let's meet tomorrow. I will go through the EHR, EMR, and these things. I will also try to speak something about ICD and CPD codes tomorrow. Okay, that will be all. Have a nice day. Stay blessed and God bless you, dear. Okay, thank you so much for attending the session. And thank you so much for being in such a wonderful audience. Okay, thank you so much.
Thank you, sir.
Thank you. I'm signing off. Okay.